Introduction. Diabetes is a chronic condition that affects millions of people worldwide. There are two main types of diabetes, type 1 and type 2. While both types affect the way your body regulates blood sugar, glucose, they have different causes, symptoms, and treatments. Understanding the differences between type 1 and type 2 diabetes is crucial for proper management and prevention of complications. 1. What is diabetes? Diabetes is a metabolic disorder characterized by high blood sugar levels over a prolonged period. This occurs due to either the pancreas not producing enough insulin, type 1 diabetes, or the body's cells not responding effectively to insulin, type 2 diabetes. 2. Causes. Type 1 diabetes. This type is believed to be an autoimmune condition where the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. The exact cause is unknown, but genetic and environmental factors are thought to play a role. Type 2 diabetes. This type is primarily caused by lifestyle factors such as obesity, lack of physical activity, and poor diet. Genetics and family history also play a significant role in the development of type 2 diabetes. 3. Symptoms. Type 1 diabetes. Symptoms often develop quickly and may include increased thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, and irritability. Type 2 diabetes. Symptoms may develop slowly and may include increased thirst, frequent urination, fatigue, blurred vision, slow healing of wounds, and tingling or numbness in the hands or feet. 4. Diagnosis. Type 1 diabetes. Diagnosis is typically made through blood tests that measure blood sugar levels. Additional tests may be done to check for the presence of autoantibodies that attack insulin-producing cells. Type 2 diabetes. Diagnosis is also made through blood tests that measure blood sugar levels. Other tests may be done to assess insulin resistance and rule out other possible causes. 5. Treatment. Type 1 diabetes. Treatment involves daily insulin injections or the use of an insulin pump to replace the insulin that the body is no longer producing. Blood sugar levels must be monitored regularly, and a healthy diet and regular exercise are essential. Type 2 diabetes. Treatment typically involves lifestyle changes such as weight loss, healthy eating, and regular physical activity. In some cases, oral medications or insulin therapy may be necessary. 6. Complications. Both types of diabetes can lead to serious complications if not properly managed. These may include heart disease, stroke, kidney disease, nerve damage, foot problems, and eye damage that can lead to blindness. 7. Prevention. While type 1 diabetes cannot be prevented, type 2 diabetes can often be prevented or delayed through lifestyle changes such as maintaining a healthy weight, eating a balanced diet, and getting regular exercise. 8. Risk factors. Type 1 diabetes. Risk factors for type 1 diabetes include having a family history of the condition, genetics, and exposure to certain viruses. While these factors increase the risk, they do not guarantee that a person will develop type 1 diabetes. Type 2 diabetes. Risk factors for type 2 diabetes include being overweight or obese, having a sedentary lifestyle, having a family history of diabetes, and being over the age of 45. Ethnicity also plays a role, with African Americans, Hispanic Americans, Native Americans, and Asian Americans at higher risk. 9. Management. Type 1 diabetes. Managing type 1 diabetes requires a lifelong commitment to insulin therapy, blood sugar monitoring, a healthy diet, regular physical activity, and regular visits to healthcare providers. Continuous glucose monitoring systems and insulin pumps can help simplify management for some individuals. Type 2 diabetes. Managing type 2 diabetes involves lifestyle changes such as losing weight if overweight, eating a healthy diet low in sugar and saturated fats, getting regular physical activity, monitoring blood sugar levels, and taking medications as prescribed. 10. Monitoring. Type 1 diabetes. People with type 1 diabetes must monitor their blood sugar levels regularly, usually several times a day. This helps them adjust their insulin doses and manage their blood sugar levels effectively. Type 2 diabetes. Monitoring blood sugar levels is also essential for people with type 2 diabetes. This can help them make informed decisions about diet, physical activity, and medication adjustments. 11. Diet. Type 1 diabetes. A healthy diet for people with type 1 diabetes includes a balance of carbohydrates, proteins, and fats. Carbohydrate counting is often used to help manage blood sugar levels, and meals should be timed to coincide with insulin doses. Type 2 diabetes. A healthy diet for people with type 2 diabetes is similar to that for type 1 diabetes, focusing on whole foods, lean proteins, fruits, vegetables, and whole grains. Portion control and carbohydrate counting may also be beneficial. 12. Exercise. Type 1 diabetes. Regular physical activity is important for people with type 1 diabetes to help control blood sugar levels, maintain a healthy weight, and reduce the risk of complications. However, exercise can affect blood sugar levels, so monitoring is essential. Type 2 diabetes. Exercise is also important for people with type 2 diabetes, as it can help improve insulin sensitivity, lower blood sugar levels, and reduce the risk of heart disease. Aim for at least 150 minutes of moderate-intensity aerobic activity per week, along with muscle-strengthening exercises twice a week. 13. Emotional well-being. Both types of diabetes can have a significant impact on emotional well-being. Living with a chronic condition can be challenging, and feelings of frustration, anger, and sadness are not uncommon. It's important for individuals with diabetes to seek support from healthcare providers, family, and friends, and to prioritize their mental health. 15. Potential complications. Type 1 diabetes. Untreated or poorly managed type 1 diabetes can lead to serious complications such as hypoglycemia, low blood sugar, diabetic ketoacidosis, a life-threatening condition caused by a lack of insulin, and long-term complications including heart disease, nerve damage, kidney damage, and eye damage. Type 2 diabetes. Untreated or poorly managed type 2 diabetes can also lead to serious complications, including heart disease, stroke, kidney disease, nerve damage, and eye damage. In some cases, complications may be more severe in type 2 diabetes due to the often longer duration of the condition before diagnosis. 16. Pregnancy and diabetes. Both type 1 and type 2 diabetes can affect pregnancy. Women with diabetes who become pregnant need specialized care to manage their blood sugar levels and reduce the risk of complications for both themselves and their baby. Gestational diabetes, a form of diabetes that occurs during pregnancy, also requires careful management to avoid complications. 17. Impact on daily life. Managing diabetes can have a significant impact on daily life. People with diabetes must carefully monitor their blood sugar levels, adhere to medication regimens, make healthy food choices, and engage in regular physical activity. They may also need to be vigilant about managing stress and getting regular checkups with healthcare providers. 18. Support and resources. Living with diabetes can be challenging, but there are many resources available to help. Support groups, online forums, and educational materials can provide valuable information and support. Healthcare providers, including endocrinologists, dietitians, and diabetes educators, can also offer guidance and support for managing diabetes effectively. 19. Research and advances. Research into diabetes is ongoing, with new treatments, technologies, and approaches to management constantly being developed. Advances such as continuous glucose monitoring systems, insulin pumps, and new medications have improved the quality of life for many people with diabetes. 20. Conclusion. Diabetes type 1 and type 2 are complex conditions that require ongoing management and care. By understanding the differences between the two types of diabetes and the importance of proper management, individuals with diabetes can reduce their risk of complications and lead healthy, fulfilling lives. With the support of healthcare providers, family, and friends, people with diabetes can effectively manage their condition and minimize its impact on their daily lives. Diabetes type 1 and type 2 are complex conditions that require lifelong management. While they have different causes and treatments, both types can be effectively managed with proper care. By understanding the differences between type 1 and type 2 diabetes and making healthy lifestyle choices, individuals can reduce their risk of complications and lead full, active lives. Regular monitoring, adherence to medication and treatment plans, and a supportive healthcare team are essential for optimal diabetes management.